Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about mycetoma. Mycetoma is a chronic, long-standing condition that is caused by certain germs, for example, fungi and bacteria, and it is characterized by presence of painless nodules, sinus tract formation, and a discharge that contains grains or granules. A nodule, by the way, is a small, solid, firm swelling that can develop just below the skin, and it usually measures more than 1 centimeter in diameter. Sometimes the nodule can get filled with pus, and it can form what we call an abscess, a pocket of pus. A sinus tract is an abnormal tunnel, a channel that develops within the body, and it connects the abscess, the pocket of pus, to the skin. So it is through this sinus tract that the pus can come from the tissues within the body to the outside on the skin through a small opening called a sinus. While the granules are tiny sand-like particles, usually of different colors. They can be white, black, yellow, red, and they are usually contained within the pus or within the discharge that comes out of the sinus tracts via a small opening called a sinus. They are like grains, they are sandy, they look like sand, and they have different colors, and the colors are dependent on the type of germ that is causing the mycetoma. The fungi that commonly cause mycetoma include Madura mycetomatis, Pseudoschelichia boydii, Madura graziae, Leptosphaeria senegalensis, Cavalleria lunata, and the Acrimonium species of fungi. While the bacteria that commonly cause mycetoma include the Nocardia brasiliensis, Actinomycetoma madurae, Actinomycetoma pelletieri, and Streptomyces somaliensis. In rare cases, it can be caused by pyogenic bacteria, those bacteria that are able to cause pus within the tissues of the body. For example, Staphylococcus aureus. These are just names that we assign to these bacteria and fungi. Majority of these bacteria and fungi that I've just laid out are commonly found in soil, water, and plant matter, except for the Staphylococcus aureus, which commonly resides on our skin. These bacteria and fungi may enter deep into the body via an injury on the skin, especially the skin of the foot. And this is very common when an individual has been, for example, pierced by a thorn on the foot, especially for individuals that walk bare feet. Once these fungi and bacteria enter deep into the tissues of the body, they are supposed to be eliminated by the cells of the immune system, for example, the neutrophils. The immune system, by the way, is the system within our body that is responsible for protecting us from invading germs. In our context, the bacteria and fungi that cause mycetoma. Once the bacteria and fungi have been introduced deep into the tissues of the body, they can multiply in large numbers, and they aggregate, they join together, and they form what we call the granules. Granules are like grains. They are sand-like, they look like sand, and they have different colors. The color of these granules or the grains is dependent on the type of bacteria or fungi that was introduced into the tissues of the affected area. The following fungi will produce black granules or black grains: Madura mycetomatis, Madura graziae, Leptosphaeria senegalensis, and Cavalleria lunata. So these fungi will produce the black grains or the black granules. The following fungi will produce the white or the grayish grains or granules. The Nocardia species, for example, the Nocardia brasiliensis, the Nocardia asteroides, and the Nocardia madurae. Other bacteria that will produce the white or the grayish granules include the Streptomyces somaliensis and the Actinomycetoma madurae, while the Actinomycetoma pelletieri will produce the red granules. Once these bacteria and fungi start to multiply and aggregate to form these granules or the grains, the cells of the immune system called the neutrophils will be recruited in the affected area. The recruited neutrophils will now engulf, they will swallow the granules. Remember, the granules were formed as a result of the multiplication and subsequent aggregation, that is joining together of the bacteria or the fungi causing mycetoma in that particular patient. Once the neutrophils engulf, swallow the grains or the granules, they'll arrest them in a small sac called a phagosome. Now, the phagosome has to unite with another structure of the neutrophil called the lysosome. The lysosome contains some enzymes, and once there is a union between the phagosome and the lysosome, these enzymes will kill the bacteria or the fungi within the grains. As time goes on and the infection is still ongoing, other cells of the immune system called the macrophages will be recruited in the affected area, and this will help to clear out any dead tissues in the affected area such that the place can heal. Some of the recruited macrophages will elongate and they will form cells called the epithelioid cells. This will surround the granules, and this can help to prevent the infection from spreading. They will form a wall around the granules, and other macrophages will join together to form bigger cells called the giant cells. These giant cells can also help to form a wall around the granules such that the infection does not spread. Most cells of the immune system, for example, the lymphocytes and the plasma cells, will be recruited in the affected area, and this will further contribute to the formation of the wall around the granules, and this will prevent the infection from spreading. The recruitment of these cells of the immune system in the affected area will lead to formation of a cluster of cells. This cluster of the cells of the immune system is called a granuloma. Clinically, the granuloma will present as a nodule in the affected area. A nodule, by the way, is a small solid firm swelling that usually develops under the skin of the affected area, and it usually measures more than 1 centimeter in diameter. The nodules are the physical manifestation of the granuloma, the cluster of cells that are forming a wall around the granules that were formed by the bacteria and the fungi. While this is all going on, there can also be destruction of the tissues of the affected area, for example, the muscles, the tendons, and the bones. The nodules will later be filled with pus. There will also be development of abnormal channels called the sinus tracts. These sinus tracts will drain the pus from the deeper tissues of the body and the nodules to the skin, the surface of the skin. This pus will also contain the grains or the granules that were formed as a result of the aggregation of the bacteria or the fungi that are causing mycetoma in that particular patient. The type of mycetoma that an individual will end up with is dependent on the type of germ or microorganism that was introduced into the tissues of that particular individual. The type of mycetoma that an individual will end up with is dependent on what type of microorganism or germ that was introduced into the tissues during the injury of that individual. The first type of mycetoma is the Eumycetoma. Eumycetoma is caused by a fungus. The second type is the Actinomycetoma. Actinomycetoma is caused by a bacterium. The third type of mycetoma is the Botryomycetoma or Botryomycosis. Botryomycosis or Botryomycetoma is specifically caused by the bacteria that have the potential of causing pus formation in the tissues, especially Staphylococcus aureus. The individuals that are commonly affected by mycetoma include individuals that reside in the tropical and subtropical areas of Latin America, Asia, and Africa, the male gender, the farmers, and individuals that walk bare feet. The parts of the body that are commonly affected by mycetoma include the feet, and majority of the time the infection starts on the dorsal aspect, that is the top aspect of the foot. The feet are the commonly affected parts of the body. The second common site affected by mycetoma is the hand, although other extremities can be affected, for example the legs, the thighs, and the wrist. Mycetoma can as well affect the buttocks and the back, especially in individuals that carry material on the back. In rare cases, mycetoma can as well affect the head, the neck, the internal organs, for example the lungs and the brain. When it comes to the signs and symptoms of mycetoma, the different types of mycetoma will present the same way. All these types will present with swelling or nodules, painless nodules. They also present with sinus tracts and a discharge that will contain granules or the grains. However, the sinus tracts, the nodules, and the grains will have some variations. For example, Eumycetoma, that is mycetoma caused by the fungus, which by the way commonly affects the foot and the extremities, will present with a single swelling or diffuse swelling of the affected area, for example the foot, or a single nodule on the affected area, for example the foot. The affected area might also have a few sinus tracts. There can also be a serous discharge. It will not contain any blood or pus. It will just be clear discharge. The discharge will also contain some grains, and these will be either black or white in color. The sinus tract of the Eumycetoma can appear later on during the infection. They don't appear early. The swelling of the Eumycetoma or the nodules of the Eumycetoma will be well defined. They'll have well defined margins. However, for the Actinomycetoma, that is mycetoma caused by bacteria, the bacteria I laid out earlier, it also presents with the sinus tracts, the nodules, and the discharge that has the grains. But like I detailed earlier, there will be some variations. For example, the Actinomycetoma will have multiple nodules on the affected area. Actinomycetoma, by the way, is very common on the head, the chest, and the abdomen, unlike the Eumycetoma that is common on the extremities and the foot. The sinus tracts of the Actinomycetoma appear very early, unlike the ones of the Eumycetoma that appear later on during the infection, and they are usually many in number. There is also a purulent discharge, that is pus coming out of the sinus tracts. The pus will also contain grains, the granules, but these will be either white, yellow, or red in color. Bone involvement is also very common in actinomycetoma. That is, the patient will have osteomyelitis, bone infection. The complications of mycetoma include osteomyelitis, that is bone infection. There can also be significant limb disability, and in rare cases, mycetoma can warrant an amputation, so the affected individuals might lose their limbs. The investigations that we carry out in mycetoma include a gram staining. We can also do a potassium hydroxide mount. We can also do a modified Zn staining and a culture. When it comes to the treatment of mycetoma, the following can be employed. In Eumycetoma, that is mycetoma caused by the fungus, we employ the antifungal agents. For example, amphotericin B and itraconazole. In actinomycetoma, that is mycetoma caused by the bacteria, we employ antibiotics. For example, we can employ a combination of antibiotics. For example, the amikacin and cotrimoxazole. Other medications that we can employ in actinomycetoma include the penicillins. We can also employ dapsone iodides. When it comes to the prevention of mycetoma, the following can help. Please avoid walking bare feet. Wearing shoes can protect your feet from getting injured. And if you see any of the signs and symptoms that I've laid out earlier in the different types of mycetoma, please come to the hospital such that a diagnosis can be made and treatment can be instituted on time. Early diagnosis and treatment can prevent damage to the affected area. It can also prevent loss of the affected area, for example, the foot, because sometimes the damage can be too much that some individuals even warrant an amputation. That is, the limb has to be cut off. That is what I had for you. Thank you so much for watching and listening. Please share my videos and also subscribe. See you in my next video. Bye.